Hello everyone, it's Dr. Elisha Van Dusen again with today's 3-Minute Health Talk. And I'm going to talk a little bit more about intermittent fasting. This is part 3 actually of that series. And I'm going to talk about some of the things you should look out for maybe, and maybe some contraindications to do that. Just things you should be aware of before you do it. So once again, intermittent fasting is shown to help with things like weight loss, insulin resistance, decreasing inflammation, your heart health, cancer, cutting down on cancer risk, brain health, also anti-aging. They did experiments in rats and showed that rats that did the intermittent fasting lived 36 to 83% longer, for example. And things like that, many different health benefits that your body can have and your brain can have too as a result of intermittent fasting. And it also makes your lifestyle much simpler. It's simple, but it can be, eating healthy is simple, but sometimes it can be hard to stick to because of the work that goes into preparing foods and cooking healthy meals. So it makes healthy eating simpler just because you have fewer meals to cook and less stuff to clean up after each meal. But some people should be careful with intermittent fasting and maybe even avoid it altogether. It's really not for everyone. Of course, one of the side effects of intermittent fasting is you might feel hungry, of course. That's pretty obvious. And you may also feel a bit weak and shaky. But really, if you're underweight or have a history of eating disorders, then you probably shouldn't do intermittent fasting right away, or at least consult a health professional first. Women sometimes too should be careful when they do intermittent fasting. There's actually some evidence that intermittent fasting may not be quite as beneficial for women as for men. And in some cases, in rat studies, rats felt emaciated, masculinized, looked emaciated, were infertile and also missed cycles. So those are some things to watch out for if you're a woman and you're thinking of doing intermittent fasting. So, but definitely if you're underweight or have some kind of a eating disorder, history of that, you should be careful. Also, if you have diabetes, if you have blood sugar regulation problems, if you have low blood pressure, if you take medications, if you're underweight, if you're a female who's trying to conceive, or you have a history of amenorrhea, or you're pregnant or breastfeeding, then you should definitely consult a healthcare professional first. Some frequently asked questions about intermittent fasting. Can I drink liquids? Yes, as long as they have few or no calories, like water, coffee, tea, non-caloric beverages like that are great. Is it unhealthy to skip breakfast? No, not all the time. The problem is that most stereotypical breakfast skippers have unhealthy lifestyles to begin with. So if you eat healthy food most of the time, the rest of the day, then it's fine. Can you take supplements while fasting? Yes, but keep in mind that some supplements like fat-soluble vitamins may actually work better when taken with meals. Can I work out while fasting? Yeah, fasted workouts are fine. Some people even take branched-chain amino acids before a fasted workout. Will fasting cause muscle loss? All weight loss methods can cause muscle loss, so that's why it's important to lift weights and keep your protein intake high. So, and one study shows that intermittent fasting causes less muscle loss than regular calorie restriction. Will fasting slow down my metabolism? No. Studies show that short-term fasts will actually boost metabolism. However, if it's a really long-term fast, then that can be an issue. Should kids fast? Probably not a good idea because they're growing, they're developing, they need certain calorie requirements, and probably not a good idea to have your kids do intermittent fasting. But hope that helps. And if you have any questions, you can always contact us at newhopechiropractic.com. Thank you.